Hi, good morning Sergio. My name is Susan Coleman. I'm your invigilator for the OET-speaking session on the 28th of April 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Sergio Lawrence.
And what is your candidate number, please?
My candidate number is 236329192.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Thank you. So let's start with warm-up questions. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How do you react in stressful situations?
The most important thing to do in a stressful situation is not to become nervous and react inappropriately. At this point of time, the best approach is to not to think about demands too much. Instead, keep doing tasks one by one, as fast as I can. I try to remind myself about how central my job is, and continue with my work with a positive attitude.
What happens when you disagree with a doctor's opinion?
During a shift I worked in the emergency room, I was reviewing a patient's chart. The prescription didn't look quite right. I immediately let the doctor, who was in charge of the patient's treatment, know. However, she didn't think there was anything wrong upon looking at the chart. I was still unconvinced that the prescription was right, so I went to my supervisor. With the help of my supervisor, we got the doctor to review the chart again. This time, she caught the mistake. In the instance that I disagree with a doctor's opinion, I make sure to take steps to determine which course of action is correct. Then, either work with the doctor or my supervisor to make sure that we are doing the best that we can for our patient.
What do you find the best part of being a nurse?
The best part of being a nurse is doing the job itself. It's a highly rewarding career, in which I can directly help the people who need help the most, namely, those who are in pain, or have some difficulty in their lives. Being there for both patients and their families is a great feeling that I can't think can be likened to anything else. The best part of it is that I'm doing something I love, and I get paid for it. I wouldn't exchange it for anything in the world.
What is your greatest failure, and what did you learn from it?
One past decision I always struggle with is not immediately going to college after high school. I am often hard on myself, because I tell myself I could have been where I wanted to be already, and I wasted a lot of time. But, I learned that discovering your true calling and passion in life isn't easy, and requires serious thought and time. Now, I successfully obtained an education, and continuing my career in a field I truly love. Essentially, I learned that I should be passionate about everything I do, and to never do anything for the wrong reasons.
How do you handle unexpected circumstances, like short staffing, unfamiliar treatments, etc.?
I take a step back, analyze the situation, and determine the most appropriate plan of action. If we are short-staffed and have to take an extra patient, I will modify my plan and focus on my priorities. If I have to give an unfamiliar treatment, I consult any available materials, such as nursing policies, and procedures or manuals, and ask for help. Whatever the circumstance, I welcome a challenge, and always make learning my main priority.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good morning. My name is Sergio Lawrence. May I know the reason for requesting to see me?
Well, nurse, the doctor has requested a urine sample of my daughter, and for that, I wanted to see you to get a sample bottle, and to check the procedure for getting the urine sample.
All right. Before proceeding further, may I know your daughter's name and age for the record, please?
Sure, her name is Emily Thomas, and she is 4 years old.
Thank you, Mrs. Thomas. And may I know why the urine sample is being asked for?
Yes, nurse, my daughter is getting frequent urinary bladder infection. So for the further analysis, the doctor insisted on the urine sample.
Thank you for the information. Now I will outline the urine collection process. Please pay attention to me.
Sure. You may please.
Thank you. Now, I insist you to get Emily to drink water to fill the bladder, so that she will feel the urgency to urinate.
Okay, I will make her drink enough water.
That's perfect. Now, collect only the midstream urine in this sterile sample bottle.
Okay.
Care should be taken not to contaminate the sample in any means. That is just because it may give unreliable test results. If so, the cause of bladder infection will not be correctly identified.
All right, nurse, I understand that. And how quickly I need to bring the urine sample?
Please bring the sample at the earliest, so that we can rule out Emily's condition at the earliest as possible.
All right.
Following that, the sample collected will be taken to the clinic within 12 hours.
Okay.
Initially, a dipstick test will be carried out to find out the infection. If the test report is not sufficient or requires any clarification, it will be forwarded for further tests.
Oh, I see.
That is, if needed, a full lab analysis will be performed to rule out her condition.
All right, nurse, I got it. Nevertheless, my daughter keeps getting bladder infections, and I don't think this problem will be resolved soon.
I can understand your situation. Try not to worry. In children, bladder infection is quite common. It is mainly caused by their reluctance to urinate, or else, due to the lack of hydration. You can make an observation on Emily, and can rule out if any such situations exist. I hope you understand my words.
Yes, nurse, I understand that.
Also, ensure proper hygiene is maintained. Well, I would like to know whether the doctor has given any advice on it.
Yes, the doctor gave me lots of advice, for example, about hygiene, which I have been following.
Good to hear that. Follow doctor's advice and ensure proper hygiene. I recommend to use cotton underwear as possible, and also, make sure to use only unscented or unperfumed products, since they may cause some problems.
Sure, nurse. I'll ensure that. Besides that, it's really difficult to get my daughter to drink anything. And importantly, she doesn't like using the toilet at the nursery.
All right. Please don't get upset about the child not using the toilet at nursery. It is a common phase, because she is in a new environment and needs some time to get adapted with.
Okay.
Don't worry, she will grow out of it as she gets used to the teachers.
All right. I understand your words, nurse.
Great. Well, I'll give you some advice to hydrate Emily. You can try these methods.
Okay.
Provide more fruits to Emily. Fruits have much water content and can hydrate her sufficiently. Also, use some plastic ice blocks in her water bottle, so that she will get attracted to it and can make her drink water. You can use such methods to hydrate her.
Yes, nurse. I will try your suggestions.
That's wonderful. Thank you for accepting my suggestions. Let's perform the urine sample test first, which will help to rule out her condition.
Sure, nurse. I will bring the sample at the earliest.
Thank you.
That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.